Hey everyone, welcome to today's video. Today is a case study focused on orthopedics, but also a little bit of intensive care nursing. If you have not seen my case study before, I will go through usually about 6 questions and then give you time to answer it. And then after that, I'll go through all the answers. Today's video is in collaboration with JOIIA, who's their scrubs I'm wearing right now. I have a code, Nurse Kaylee 15, where you can get 15% off the scrubs. And I'll go through a little bit more with their website and things like that later. All right, let's get into it. The scenario is an 82-year-old female fell down her front porch stairs at home. She reports she has severe pain in her right hip and lower leg. She also suffered a cut on her arm that is bleeding steadily. She lives with her husband, who called EMS. Past medical history includes hypertension, MI with stents, heart failure, osteoporosis, and diverticulitis. She reports to your ER and an x-ray is completed that shows a right fractured hip and a right fractured tibia. The tibia is broken proximally into more than 3 pieces. What type of fracture describes the tibia fracture? I'll give you guys a couple seconds here to select your answer. Question number 2. The ER provider is stitching up the large abrasion to her right arm. At this time, you receive her lab results. Hemoglobin is 6.8, normal hemoglobin is 11.7 to 15.5. The provider orders 1 unit of red blood cells. Match the following symptoms with the associated transfusion reaction. So here, with your transfusion reactions on the left, just select the associated symptoms on the right, and then you can put your answers on the far right. Question number 3. What is the priority action if you suspect a blood transfusion reaction? A. Notify blood bank. B. Call the family. C. Stop the blood infusion. Or D. Send for another unit of blood. Question 4. The patient is off to the OR for an open reduction internal fixation repair of the right hip fracture. The OR RN completes a timeout with the team. What is included in a surgical timeout? Select all that apply. A. The patient's name. B. Their birthday. C. Surgical procedure and site. And D. Consent. Question number 5. The patient is now in the ICU following the OR, and the intensivist wants to place an internal jugular central line for the administration of vasopressors. What position should you as the nurse expect the patient to be in as the provider inserts the central line? So what position do you want to prepare to have the patient in for while they insert this line? A. Prone. B. Semi-Fowlers. C. Reverse Trendelenburg, and D. Trendelenburg. Question 6. Indicate which nursing action listed in the far left column is appropriate with each potential postoperative complication. Note that not all actions will be used. So here, for the potential post-op complication of acute compartment syndrome, select which nursing action 1 through 4 you think you would do if you suspect acute compartment syndrome, and then just select or just write 1, 2, 3, or 4 in the far right column. All right, now we'll go over the answers, but before we do that, I want to tell you a little bit about JOIIA. Here I want to show you JOIIA's website and what they have to offer for scrubs. So they have both women and men's scrubs, and they have just a ton of different styles, ton of different colors. I really love, so this brand was made by someone who was in the hospital and kind of noticed how much nurses and healthcare professionals utilize scrubs to do their job. And so they made the scrubs with like the idea of being very comfy, stretchy, antimicrobial, antibacterial, and also like anti-wrinkle. So I really like they really had the like healthcare professional in mind when they were making these scrubs, which I think is really cool. You can see for the women, I got the Olivia Scrub top in a burgundy, and I got a size medium. And then for the Anastasia jogger scrub pants, I got a size small in burgundy. And I love the scrubs. They're super comfortable. They're super soft. I definitely recommend buying them and trying them out. I will add my code Nurse Kaylee 15 below, and I'll link the website as well. But you can either type it in, otherwise the link below will automate this code for you so you can get 15% off your scrubs. So yeah, if you guys have any questions about the scrubs, let me know, but I like them a lot and I definitely recommend them. So yeah, all right, let's get back to the video. Okay, question number 1. The tibia is broken proximally into more than 3 pieces. What type of fracture describes the tibia fracture? So this would be a comminuted fracture, where the bone is broken into multiple little pieces. I would suggest, if you're interested in looking up the other ones, look up kind of pictures to get an idea of what these other fractures look like. I feel like it's easiest to learn about them from looking at pictures. Question number 2. For hemolytic reaction, the associated symptoms would be fever with or without chills, low back pain, flank, abdominal, or chest pain. So a hemolytic reaction is when the recipient's antibodies attach to the antigens from the transfused blood, and this leads to the destruction of red blood cells. So this is why you get the symptoms of like that low back pain, flank, abdominal, or chest pain, because this, if not treated right away, can progress into like disseminated intravascular coagulation, DIC, acute kidney injury, or shock. So it's important to recognize this right away and then stop the transfusion of blood and notify the provider, things like that. This hemolytic reaction usually develops within the first 15 minutes, so it would be one that you'd want to watch out for right away. For the non-hemolytic reaction, this answer is C. So you have the sudden chills, a fever of greater than 1 degree Celsius, and a headache. So this reaction, the non-hemolytic reaction, is also known as febrile non-hemolytic. You're associating those two together. So here, the patient is having like a sensitivity to the donor's white blood cells, platelets, or plasma proteins. This is the most common type of blood transfusion reaction, and typically the signs you see are like sudden chills, they're like rigor, they have a fever, and they have maybe a headache or flushing. For anaphylactic, the answer is A, so dyspnea, urticaria, wheezing, hypotension, swelling of the face and tongue. This occurs when the recipient has a sensitivity to the donor plasma proteins, and they can at this point develop that anaphylactic reaction. And then TACO, or this is also known as transfusion-associated circulatory overload. The answer here is D, shortness of breath, cough, dyspnea, and distended neck veins. Here, the fluid is administered faster than the circulation can accommodate. So you're going to see those signs of like fluid overload, of pulmonary congestion. That's why you're getting that cough, dyspnea, shortness of breath. Then distended neck veins, just showing that they're fluid overloaded. What is your priority action if you suspect a blood transfusion reaction? So you want to stop the blood immediately because you don't want to be giving any more of that medication essentially that's causing a reaction. And then the other things, I would say follow your hospital's policy, but you'll typically notify blood bank. You'll obviously call the provider. And then based on what the provider wants, maybe you'd end up giving a different unit of blood. But yeah, the biggest thing is to stop the blood transfusion. Question number 4, the patient is off to the OR for an open reduction, internal fixation, repair of the right hip fracture. You complete a timeout, and what is included in that surgical timeout? So the OR nurse will include the patient's name, the birthday, the surgical procedure and site, and then also that consent was obtained. And this is really just a big safety for when patients undergo surgical procedures. Question number 5, the patient is now in the ICU following the OR, and the intensivist wants to place a central line. What position should you expect the patient to be in? You would have them be in reverse Trendelenburg while they place that line in the internal jugular and the neck here. Then question 6, so we're indicating which nursing action you would take to treat the potential post-op complication. For acute compartment syndrome, you want to remove the cause of increased pressure if possible. For deep vein thrombosis, you'd want to administer IV heparin per orders. And then for fat embolism syndrome, you'd want to initiate IV fluids and oxygen therapy. The following references were used for this case study. All right, thank you guys so much for watching this video. Please use my code NurseKaylee15 to get 15% off the JOIIA scrubs, and let me know what color you get. All right, I will see you guys in the next one.